Hello, everybody. Hello, hello, hello. Welcome aboard. This is Ask Dr. Bob, and my name is Dr. Bob Gabay. I'm the Chief Scientific and Medical Officer for the American Diabetes Association, and this is the monthly program where you ask me questions about diabetes. And we each month, as you know, if you've been following this each month, we pick a topic, an area to sort of dive a little deeper, and then we ask you to send questions. And like other months, we've gotten a bunch of questions, and this month is going to be about men's health because it is Men's Health Month. And so we have a bunch of questions. Also, if you like this program and like this information, share it with other people. And let me just, for this episode, let me make a little disclaimer because in talking about men's health, we're going to have some discussions about sexual function. And if that's not something you feel comfortable hearing about, we're going to be strictly in the medical world on that. But if that makes you uncomfortable, then feel free to tune off. Uh, but I think for those of you that want to learn about that, I think it'll be important, and we'll answer questions that sometimes men are uncomfortable bringing up when they see their healthcare provider. So. Without further ado, we will get started. And so the first question is, are there any factors that predispose men to diabetes, and things that are specific to men? And I would say largely it's the same things, but there may be a couple of nuances. So let me throw that at you. What are the risk factors? Well, obesity is really a particularly important one. And what is a little bit different in men is you may have noticed, we sometimes talk about apples and pears. Men being apples, women being pears. And what do I mean by that? Well, apple is the central part, central obesity, the pattern of obesity is more around the center. And for women, it tends to be less in the abdomen and more in the hips. And that's why we sometimes in the medical world talk about apples and pears. So it turns out that obesity in the abdomen area, in the belly area, that belly fat, is particularly high risk for developing diabetes, and men are more likely to have that. So that's one important risk factor for diabetes. Having a sedentary lifestyle, also a risk factor for diabetes. It may be more common in men, and men are more likely to smoke, and smoking is a risk factor for diabetes. And then there are the usual ones, like having a family history of diabetes that doesn't depend on your gender. And then I'll just remind you that certain racial and ethnic groups are at higher risk for developing diabetes. African Americans, Latinx, Pacific Islanders, Asian Americans, all at higher risk for developing diabetes. And hypertension is more common in men, and hypertension is sort of a risk factor in a sense. People with hypertension are more likely to have diabetes. So, you know, those are the risk factors for men having diabetes. Let's go to the next question. And that is, are there different diabetes symptoms that men should look out for? And the symptoms, again, are the same, whether you're a man or a woman. Excessive thirst, excessive urination, true either way. Fungal infections, and this is where maybe men are more likely to have fungal infections, particularly in between their toes or their feet, or in the groin area. That kind of fungal infection is more common in men. And then something we'll spend a lot of time talking about very soon based on these questions is men can experience erectile dysfunction. And we'll talk about what that is in a moment. But that is something unique to men, and it can be a symptom of having diabetes. And what I've been describing is really more all true about type 2 diabetes. Type 1 diabetes tends to be more abrupt, not a lot of symptoms, but then all of a sudden really sick, excessive thirst, excessive urination, belly pain, and becoming so sick with nausea and vomiting that one has to go to the emergency department. Okay, let's move to the next question. And these are some of the things about, differences between men and women, and it's good to get them out of the way. So one is, do men absorb glucose differently than women? No, same. Do men have a different normal A1C range? No. Are their A1C goals different? No, same, same. So now let's dive into sexual function because there are a lot of questions about this. And I think this is a really important topic to talk about. And for better or worse, men, we feel funny bringing this up with our healthcare providers, and it's important to talk about because as you hear, there's treatment. And unless you bring it up, you can't get the treatment. So, um, here's a question. Why are men with diabetes more likely to have low testosterone? So, as a reminder, testosterone is the male hormone. And sometimes men can have lower levels. Let's talk a bit about testosterone. One of the things to keep in mind is that testosterone gets lower as we age, and that is sort of a normal process or a common process. And something, if you're ever having your testosterone measured in a blood test, that you should keep in mind is that it needs to be measured in the morning because men's testosterone levels vary across the day. It starts off highest in the morning and drops off later in the day. So if you get a testosterone level measured later in the day, may not tell you anything because you may have a low level just normally. So again, testosterone levels, measure them in the morning. And there are conditions that can lead to low testosterone that men are more likely to have. And one is something that is underdiagnosed. And it is a disease called hemochromatosis. Hemochromatosis. And what is that? It's excess iron deposits. The body doesn't handle iron in the body normally. And what does it cause? It causes sort of three main things. One, liver disease, uh, low testosterone, and diabetes. So a man with diabetes and low testosterone and liver disease, got to think about the possibility of hemochromatosis because it's underdiagnosed and it can be detected with a blood test. So that's a far more unusual cause, but worth knowing about. But let's talk about really the thing that's on many men's minds, and that is erectile dysfunction. And so one of the questions is, how common is erectile dysfunction? And you'd be surprised to know that for people with diabetes, probably 20 to 30% of men can have erectile dysfunction. So it's really common. But the number of men diagnosed and treated for it is much, much lower because, again, men don't bring this up because it can feel maybe embarrassing or awkward. And you need to know that if you've got this issue, you need to talk to your healthcare provider. So, what is erectile dysfunction? And I'll give you the medical definition here. It is the inability to either acquire or sustain an erection um, long enough for satisfactory intercourse. So it's either acquiring or maintaining that erection for sexual intercourse. And so before we get into the questions about why do men with diabetes develop erectile dysfunction, I think it's helpful to understand what's involved physiologically for a man to have an erection. What are the steps? And there are really three steps. There are really three things. First, there's interest. Something has to spark a man's interest, right? And that is called libido, having sexual interest. That happens in the brain, and that is what testosterone is really important for. So men that don't have testosterone tend not to have much of a libido or interest in sex. So, number one is interest. That interest in the brain then needs to be transmitted by the nervous system to the apparatus that has the erection, um, uh, uh, to the penis. So, you need number one, the interest. Number two, the nerves working properly, and that's a place that in diabetes there can be issues. And then after the interest and the nerve transmitting the information to the penis, the blood vessels need to dilate, open up, and allow more blood flow. And that's literally what leads to the erection. It's increased blood flow. So you need to have that ability. Those blood vessels have to work right, get the signal from the nerve, dilate, and allow more blood flow. So again, it's interest, it's the nerves transmitting that interest to the penis, and then it is the blood flow in the penis, the blood vessels opening up to allow more blood to lead to the erection. And again, as I gave you a disclaimer at the beginning, we're going to get into it here because men need to know about this and get treatment because treatment is available, as we'll talk about in a moment. So, uh, what what happens for people with diabetes when they develop erectile dysfunction is often the problem is around both the nerve transmitting that information to the penis and in particular the blood vessels not dilating. And when we talk about treatment, the treatment is really about helping those blood vessels dilate. One of the questions that doctors will often ask to help figure out whether it's a testosterone issue or whether it's the nerves and the ability of the vessels to respond is whether somebody has morning erections. Morning erections really just come from the brain and are unconscious and do not require all those other sort of psychological aspects to play out. And so that is a question that if you wonder why is your doctor asking you that, that's the reason. Okay, so we talked about why men with diabetes can develop erectile dysfunction. And the next important question is, are there medications that men with diabetes can take to treat erectile dysfunction? And there absolutely are. And I want to talk about those medicines. I want to talk about how they work. And I want to talk about some helpful tips around them. So let's get started. So, uh, the class of drugs are called Pde5 inhibitors. And you don't need to know that necessarily. But what they do is they act at that last step. They dilate the blood vessels of the penis and therefore lead to an erection. Um, and their names, their chemical names, all have the thing at the end of "phil." So, sildenafil, tadalafil, vardenafil, evenafil. Otherwise, commonly known in brand names that you've probably seen commercials for: Viagra, Cialis, Levitra, Stendera. Those are four different medicines that essentially work the same, very similarly, and they dilate the blood vessels of the penis. Okay. So, what do you need to know about these medicines? A few things, and people that have tried them and they say they don't work are maybe missing some of this. So, number one, um, you still need, if you take these medicines, they don't automatically lead to an erection. They require still the brain, libido, to get excited to lead to an erection. So that's number one. Number two is they differ in how long they last. And so, in particular, Cialis lasts a long time. Not that it leads to a long-standing erection, because that is a problem. And you've probably heard on the commercials that if you have an erection that's lasting several hours, you need to seek medical attention, because that can be a very serious problem. And it is worth going to an emergency department to have that evaluated. But what I mean about it being long acting is it's in your system for 2 to 3 days, and it allows one to be more spontaneous. Anytime during those 2 to 3 days can be an opportunity to have an erection. That's for Cialis. The other medicines only work for a short period of time, and so you need to take them when you're thinking that one might be having intercourse. So that's another important thing to do. And the final thing I will tell you is that if you use one of these medicines once and it doesn't work, don't give up, because typically it can take 2 or 3 times to try it before one sees if it's effective or not. So give it 3 chances before you rule out whether it works. And then the last thing to know about these medicines is there's one important medicine you do not want to take with it, and you do not want to take if you're on that medicine, and that's nitroglycerin, nitrates. So people that have heart disease that regularly take nitroglycerin should not take these medicines. But people with heart disease that don't take those nitrates, it's fine for them to use this medicine. Always check with your doctor, but there's no reason that men with coronary disease cannot take these drugs. It's been proven to be safe for them. So that's a lot of information about the treatment of erectile dysfunction. And of course, talk to your healthcare provider about that. That's the most important piece here, because as I said, 20 to 30% of people with diabetes, men with diabetes, have erectile dysfunction, but only a small percentage of them ever bring this up to their healthcare provider, and therefore they don't get the treatment. And just so you know, if those medicines don't work, there are other treatments, and you should talk to your doctor about that. Okay, so that is the story on erectile dysfunction. Now let us move to the next question. Can diabetes-related erectile dysfunction be reversed? Well, sometimes it can, and probably the most important thing to know about that is getting better blood glucose control, because we know if blood glucose levels are really high, that can lead to erectile dysfunction, and treating those really high blood glucose levels can reverse the problem. So, good question to ask. Okay, again, if you're just joining in, this is Ask Dr. Bob. We do this monthly. You send questions to me, Dr. Bob Gabbay, the Chief Scientific and Medical Officer for the American Diabetes Association. And this month, our theme is men's health. And that's why I gave a disclaimer at the beginning. If you're uncomfortable hearing discussion around sex and sexual issues from a medical perspective, this program is not for you. So let's move on to the next question. Are men more likely to develop type 1 or type 2 diabetes? Well, really, like all people, men are much more at risk for developing type 2 diabetes. Type 2 diabetes accounts for 90 to 95% of all people with diabetes. So type 2 diabetes is the predominant disease. Type 1 diabetes is an autoimmune problem where the immune system attacks the cells that make insulin and destroy them. And it can happen, by the way, at any age. Okay. Next question is, what are some of the diabetes management recommendations that you have for men? Well, I'm glad you asked that. Some of this is really for all people with diabetes, and we like to think of it as the ABCs. A for A1C, or a measure of blood glucose levels, keeping your A1C in a healthy range. That's the A. B, blood pressure. Maintaining a good blood pressure, whether you need medication or not. So that's the B of A, B, C, and the C is cholesterol. Uh, Having a good cholesterol, and often for people with diabetes, requires being on medication for that to get those cholesterol levels at a safe place, because men with diabetes are at high risk for heart disease. So really the ABCs are about preventing complications of diabetes, and particularly heart disease, which is the number one killer of men with diabetes. So really important. And that's why when I think about what should men know about diabetes management, it's doing everything you can to lower your risk of heart disease. So that's the ABCs. It's quitting smoking if you do, and there are lots of resources to help you quit. Our website, diabetes.org, will give you a bunch of those. It's being active, getting your heart rate up, exercising, really helpful. And that can be as simple as walking and getting 10,000 steps, walking 30 minutes, 3 to 5 days a week. That's great. And maintaining a healthy body weight. Those are all helpful things to lower your risk of heart disease, and lowering your risk of complications of diabetes in general. Uh, Let me see if we have some questions from the audience. And again, you can put your questions in the chat and we will get to them. I know we've covered a lot of questions already. Let me see if we have one more here. Uh, and that is, so that sort of gets back to this question about erectile dysfunction. And I really like this. Oh, here's a question that I'm getting. Uh, what is the impact on statins on blood sugars? Um, and so, number one, let me say that statins are critically important. That's the class of drugs that lower cholesterol, and they're critically important to lower heart disease, particularly for men. So, if men are over the age of 45, and they've done this study with literally thousands of men, where they said, regardless of their cholesterol, if they're over age 45 and have diabetes, and they're given a statin versus another group not, the people that are given statins live longer, have fewer heart attacks. So um, once you hit 45, you're likely to benefit from being on a statin. Now, statins do have a small effect on blood glucose levels, and they can raise them a little bit. But even with that effect, the benefit of lowering the risk of heart disease is much greater than the small increase risk of increasing blood glucose levels. So again, if you're going to weigh the two, much better to be on a statin to lower the heart disease risk. And so the last question gets back to erectile dysfunction, uh, and says, I feel funny talking about this with my doctor, and what should I do? And can I talk about it? And I'll tell you that physicians, nurse practitioners, physician assistants, they're all trained to have these kind of professional conversations. And so you feel funny bringing this up, but I guarantee you they'll be much more comfortable than you. They'll be glad that you brought this up, and they can help you, but they can't help you if they don't know you have the problem. So I think you could be as simple as, I think I might have erectile dysfunction. And then they'll take it from there. They'll ask you questions to help sort that out. And really, men, men in the audience, I can't implore you enough. You know, why go through life not getting treatment for something that's important. You know, uh, it's an important thing. Bring it up, ask, and you can get treatment. Um, so with that, I think we are running out of time. I'm going to just remind everyone that this is Ask Dr. Bob. I'm Dr. Bob Gabay, the Chief Scientific and Medical Officer for the American Diabetes Association. If you like this program, please spread it to your friends and family. We do this every month. You can also follow me on Twitter at Dr. Bob, at Dr. Bob Gabay, and spread the word. Thank you for all being part of this, and look forward to seeing you next month. So thank you very much, and be well.